Hi everybody, it's Dr. Kelly and welcome again. Thanks for joining me. I want to thank you all so much, everyone who's been following me, giving me thumbs ups and sharing my videos. I so much appreciate that. I hope everybody's had a wonderful Thanksgiving. I've gotten to speak with a lot of you recently. I know I'm going on a little bit early tonight, but you know what? It's winter and it gets dark so early that I was just thinking about it tonight that now that we're in winter, it's so dark, I actually start my bedtime routine a little bit earlier than I do in the summer. I've got my birds put to bed already. The dogs and the cat have been out. They're all ready for bed. And here I am waiting to go live with you. So I thought I'd bump it back up again to the 8:30 mark. I know for some of you that interferes with putting kids to bed, but it's on Facebook, so it's going to be there. So if you haven't already gone to my page, Dr. Kelly's Discovery Health on Facebook, go there please and like it, and you can follow me and you can see when I go live, and then you get a little notice. So if I go a little earlier, if I go a little later, you'll always get a notice, and then it's super easy for you to find that live video. So it doesn't mean that you have to join when it gives you a notice, but it'll be an easy way to find it. So thanks for joining me. I appreciate you being here. And what I like to bring to you guys are things that come up in the people that I'm working one-on-one with, because I know you can benefit from the conversation that I had with somebody else. And what I repeatedly say to people that I'm working with is that, the funniest thing is how things go in streaks. Things go in threes. So when there's one person with this issue, all of a sudden it comes up again and it comes up again. And what I want to challenge you with tonight is just to start to think a little bit about the things that you're doing. Hey, Dave, think about the things that you're doing to get yourself healthy. Okay, so these are one of my new favorite snacks. I don't know if you've ever seen them before. I call them hippie peas. It looks like they're actually hip peas. They're organic chickpea puffs. So they're my cheesy poofs, but they're organic. They're made out of chickpeas. They're not made out of corn. So that's fantastic. So they're made with better ingredients. I get this at Costco. I was at my brother-in-law's house over the summer. They had these and I'm like, these are great. What's in there? Whole bunch of organic ingredients. Definitely, Dave, try them. The first time after I tried them, we got them for a little while at Costco, and then Costco took them away. And I'm like, where can I get those hippie peas? I need to get some of those hippie peas for a snack, right? We all need different snacks. I can't eat vegetables all the time or only whole foods unless I'm detoxing, unless I'm focusing on that. So this is an alternative as a snack. One of my favorite little snacks. Again, it's like eating cheesy poofs, but they're made out of better ingredients. Chickpeas, organic chickpea flour, organic rice flour. There's some sunflower oil, tapioca, pea, brown rice, salt, a little bit of sugar, onion, garlic, and then some lactic acid. So overall, a pretty good choice. I was snacking on these earlier tonight, and it made me think about what topic I wanted to talk about tonight. So it's not the snacks that I was talking about with my patients, but even though I just showed you this snack, the hippie peas that I like, hey, Brianne, it's a snack, right? So they're a pretty darn good snack, but it's still a snack. It's still a treat. So are these healthy for me? It's kind of a trick question, right? They're better, but they're still just a snack food. They're still, it's not like I'm eating chickpeas here, people. There's a lot of other ingredients there that I just read off to you. You've got to read the ingredient list always. Hello, Julie. So they're a better choice, but they're still a snack. Are these hippie peas healthy for me? Do they make me healthy? What's the answer, people? Of course not. They don't. These don't make me healthy. Do they satisfy a crunch that I need? Do they satisfy a little snack? I ate supper. I just want a little something. We all go through phases of that, and sometimes more than others. I get it. I'm there too. There are times where I eat exceptionally well, and that's great, and I always feel better. But there are times where I eat good most of the time, the majority of the time, and then I'm having a snack like this, which is a better snack, but it does not make me healthy. So for all of you out there who may be doing some snacks like that, they're not making you healthy. Now, what I really wanted to talk more about was supplements. That's the conversation I had with somebody this week. Somebody, and there are a lot of you who are like this, who are always looking for the next supplement. Ooh, I need to take this because it's good for my eyes. Ooh, I need to take this. It's going to help me lose weight. Ooh, I need to take this supplement. It's going to help me with this. Dave, they're a little hard. They're softer in the middle. It's like a cheese puff. So it's not going to hurt your teeth, but they're a little crunchy. To answer your question there about my hippie peas. So supplements, I have the same question for you. I asked you if my hippie peas made me healthy, which they don't, but they're a good snack. They're a better snack, still a snack. So when you start taking a long list of supplements, or when you work with someone who keeps you on supplements forever, are they really doing you any good? Taking a slew of supplements, do they make you healthy? Do supplements make you healthy? That's the next trick question. You got to think about that for a little while, I bet. The answer is no. They don't make you healthy. Think about what supplements are for. Think about what they're called. Supplement. This is what I tell everyone I work with. They're supplements. They're to supplement something that's deficient in your body, to support your body, to help it to change, or to help you get rid of something you're toxic in. Okay? They supplement your body. But the whole goal of working with a practitioner who's focusing on functional medicine, integrative medicine, or holistic health is to get you healthy. And if you're truly healthy, you don't need a big long list of supplements. They don't make you healthy. You want to take the things that your body needs. So we all get deficient, or I shouldn't have said that quite like that. The majority of people are very deficient in magnesium, in iodine, in their B vitamins, in vitamin C, in vitamin D. So there's definitely a slew of vitamins that people are often deficient in. So the goal there is, let's take vitamin D, for example. Does everyone need to take high doses of vitamin D always? No, they don't. They need to check their vitamin D level. They need to know how deficient they are, and they need to replace it to get their levels up to that 60 to 80 value when they get their blood tested. And then they need to know how to keep themselves there. Okay, so that doesn't mean they should be taking the exact same dose all the time, especially in the winter, you're going to need more. In the summer, you're going to need less if you get some sunshine, which I absolutely encourage people to get sunshine. I don't take a regular vitamin D. I work on getting sunshine a lot, and I'm able to maintain my vitamin D levels. And I do use a vitamin D bed, and it's a tanning bed, through the winter. I don't go in there a lot, but if I go in there just a little bit, I can keep my vitamin D level up in the 80s and 90s. That's pretty significant. So does the supplement make you healthy? No. The supplement replaces what's deficient And then once you're at the level where you're supposed to be, you can back off because your body should be able to maintain it. And if your body's healthy, you shouldn't need all of those supplements. I know, I agree with you, Brienne. Yeah, I love the sunshine too. It's healthy for you. You need it. That's how we were made to make vitamin D. Do I believe in burning yourself? Do I believe in excess of it? No, I'm not talking about that, people. So don't go there with that. But we were made to absorb the rays from the sunshine to create vitamin D. You just can't do it excessively. So I remember when I met a woman with a little girl who was maybe about 9. Let's say she was about 7 or 9. And she had been seeing another practitioner for a year or two, and they were going to be switching over to start working with me. And this little girl had been on 10 to 15 supplements, big time supplements, big herbal liquid supplements for 2 years straight. Now think about that. Did that practitioner really help that girl and her mom to get her healthy if she was on those same supplements for almost a full 2 years? I don't think so. Not at all. Those supplements weren't making her healthy. They were missing some pieces of the puzzle to help that little girl get healthy and to, again, replenish what was deficient, support where she needed support, and then get you off of it. I always tell everyone, we're gonna, we might get on a lot of supplements for a while because you need them, but we're gonna work really hard to get your body in a better spot, in a good place, so we can get rid of them. There's a few things that we stay on. You should take some vitamin C on a regular basis. The more and more I read about vitamin C and all of its fantastic benefits and how we're lacking that, and getting enough vitamin C is helpful with everything, every cell function. But for the great majority of things, most people don't need to be on it long term. You always want to get it from your food over purchasing a supplement. But there are times where you need higher doses, concentrated, couple of times a day, and so you need a supplement in addition to the food. So my point here tonight, people, is you might want to be taking supplements, or you might be working with someone who has got you on some supplements, but stop getting fooled because the supplements don't make you healthy. You've got to do the work to make yourself healthy, okay? You've got to work on cleaning up your body, finding out the cause, where you're deficient, getting it replaced, and getting your body functioning better, and you won't need all those supplements. So stop falling for all of the advertisements that said, here, take this for your joint pain. Here, take this for your vision. Here, take this for your diabetes. Here, take this for whatever. What does that sound like? Those supplements then are doing the same exact Band-Aid that medications do. I don't practice that way. I don't want to practice that way. I want to use the supplements, and I use medications sometimes too to get your body where it needs to be, and then we can start backing it off. So stop using supplements for a symptom. You got to start to heal your body, and you've got to get healthy. Okay? So I hope that makes sense. Supplements don't make you healthy. You've got to do the hard work behind the scenes. You've got to clean up your diet. You've got to clean up your body. You've got to get things functioning well. And for anyone who's interested, I want you to keep watching. I will be posting things soon, but it's not ready yet. In January, I'm launching a new program, a little bit different. I'm going to work with a group of people at the same time. We're going to have weekly conference calls, and there's course materials. So it's going to be a course, and it's going to be live. It's going to be a 6-week course to teach you everything you need to know to get healthy. So Dave, to answer your question, there are a lot of different supplements that do help with different diseases. I didn't say that they don't, but taking a supplement doesn't make you healthy. And think about this. If you take the same thing every single day for 5 years, is it really doing you any good at that point anymore? It probably isn't. Your body's gotten too used to that. So sometimes you got to change things up as well. Lori asks, should you take vitamin C once a day? Maybe. Lori, maybe. You, depending if, you've got a cold or if you're fighting a cold and knowing it's winter, you can take vitamin C a couple of times a day. If you're doing it for just a maintenance to stay healthy, once a day is perfect. So lots of great information. I didn't say that supplements are bad for you. What I said is that they don't make you healthy. Make sure you're doing the other things to help get your body healthy, because when you're truly healthy, you won't have joint pain. When your body is healthy and functioning right, you won't have diabetes. When your body is healthy, you'll be able to lose weight. Your hormones will be balanced. You won't need to keep taking the supplements for your hot flashes when your body gets back in balance and gets healthy again. Okay, so just a little bit of a different perspective. It doesn't mean that happens overnight either. Sometimes that can take months at a time for things to get supported and to get to the right spot. But you shouldn't be long-term on any one supplement. Let me give you turmeric or curcumin as another example. I meet a lot of people who were told turmeric and curcumin are great for you, which it is. It's a fantastic herb. I use it a lot. But for all of those people who were told or put on by another practitioner, long-term, when I check their food allergies, guess what they're allergic to? Turmeric and ginger. So your body can get sick of things in supplement form too. And just because it's a good thing doesn't mean you should be taking it all the time. All right. So watch for my January program. Okay. It's going to be great. It's going to fit the price tag well for a lot of you. It's going to be an intense program, 6 weeks. Every week we're going to meet and I'm going to teach you everything you need to know to get healthy. Don't be thinking about your New Year's resolution. Make a bigger commitment. Make a commitment to get healthy. And if you join me for those 6 weeks, you're going to have the tools you need. You still have to do the work, but you're going to have the tools you need to get healthy. So please share my videos. Please like my page. And remember, you can follow me and you can ask to see whenever I do a live video. And I will talk to you again real soon. Have a good rest of your night. Where's my aw?